Welcome everyone to How to Ace Your NDIS Audit. Thanks for coming along. And as I just described, we could have, we'll be having people pop in probably for the first 15 minutes as usual. And this meeting is being recorded, so it will be sent out to you. So yeah, so no dramas for those who have to leave early, etc., or want to sit down and watch it with their team. So it's no problem at all. So I'm Gina Ingrell. For those of you who may not know me, I can recognize a couple of names in here. So you probably do know me, but yes, I'm Gina Ingrell from Effective Policy. I'm CEO and founder of that organization. Just for information's sake, I have a background in health and human services which spans over 35 years. My auditing and assessment career pretty much started in 2004 when I became a standards assessor for what's now known as QIP, but used to be QMS. And I used to assess under the health and community service standards in the alcohol, tobacco and other drug standards. And these days, really, I'm just focusing mainly on NDIS because it's a really incredibly exciting, might be the wrong word, I'm not sure, but it's exciting because so much is going wrong. And I guess there's a lot of things going right too, but there's certainly no end of surprises and good work to be done in the NDIS sector. So here I am. So why that matters for getting ready for audit, because I've got a lot of experience at doing that in tons of different services. Whether they're NDIS or not. As I say, my focus has been for the last 5 years just on NDIS. So really this is about trying to help you get the best result at your audit, but also I hope to offload a bit of information around, why it's important not to just want to do well at audit, but try to maintain that a level of quality throughout the year as well. So let's focus on, first of all, I'll just talk about the types of audits. And put your hand up if this is your first audit. Put a virtual hand up, or you can just do a yo with your voice. Just want to get a sense of who's going into their first audit. And I've got no hands up so far for that. Then we've got Tanya. Tanya's going into her first audit. Oh, we've got Carmen. Okay, lovely. We've got a few people going in to their first audit. All right. And whether or not that's going to be a provisional one, which means you have no clients at all, or whether it's going to be certification because you have clients, you'll be able to decipher the difference by whether you have clients or not. Thanks, Jessica. I saw your hand up as well. Great. So that's provisional. Oh, that's lovely. That's lovely putting it in the chat for me. Okay. Yeah. So some people can be going into their first audit and have zilch clients. Okay. Brand new, never delivered a service. And other people will have been delivering unregistered, and they may be going into their first audit, but it'll be certification because there are clients. And you've got a lot more work to do. You've got a lot more work to do than anyone who's going in there as a provisional, that's for sure. So then we have another audit. We have another one, which is your, if you're a certification level, as opposed to verification level, which is low risk. If you're certification level, you will have another audit 18 months down the track from your first one, or your point of registration, the date of on your registration certificate. And that audit is called your midterm audit. And that one focuses on one division within the core module, which is called governance. And everybody thinks, well, a lot of people can think, oh, that's just easy. They're just doing division 2. It's only governance, but you've got to remember, and I want you to know, governance is everything. I mean, it may only be the governance practice standards, but the governance practice standards have a tentacle in just about every area of your business, therefore can wander off into the other standards that are not directly being looked at during a midterm. Yeah. So don't have any false securities that a midterm is just going to be a breeze. I've seen people come out with 50 non-conformities and been put into a 90-day review from a midterm. Now, sometimes there are really pretty awful auditors. Let's face it, there's good and bad everywhere, and nothing should change in relation to auditing. We have good auditors, we have not so good auditors, and then we have pretty bad auditors. Okay, so sometimes you might come out with absolutely no non-conformities, and then you'll go to somebody else will look at your previous audit and wonder how you got through. So you don't know. You can just try to have a decent auditor, but you really don't know what you're going to get. For example, yesterday we had a group that we were helping. They had some non-conformities. They were given a 90-day review cycle. They were told they had one major non-conformity. And then as we were going through their final stages of tidying up all their minor non-conformities, they actually had 3 minor non-conformities in 2 different practice standards, which meant 3 minors in the one practice standard equals major non-conformity. And these auditors had not picked that up. And do you know that there would have been no sympathy from that audit company or the next audit company or the commission that they hadn't picked up that they had 2 extra major non-conformities and that they weren't told to fix them? So, you never know what you're going to get. So try to pick a reputable audit company. I always choose QMS. Their head office, I think, is in Newcastle. I tend to follow auditors more than the company themselves, but QMS has been really stable for us. The same auditor has been there. I've branched out into other auditors as well. They manage our clients well. I've not known them to be rude to our clients, and I have known many other audit companies to be rude, and that just makes a difficult job much harder. So then there's the last kind of audit, which is your re-registration, and that is the entirety of all of your standards, and obviously a big and comprehensive audit, like your first one would be if you had clients. So different types of audits: your provisional first time or certification first time, you've got your midterm, you've got your re-registration, and you've got what's called a 90-day review cycle, which is when what I discussed before, when you have major non-conformities to the level that they can't be fixed within a few days, you will be put into something called a 90-day review cycle. You're given 90 days to fix those majors, close them out, and the minors don't have to be closed out for 18 months, unless there's 3 in the one practice standard, and then you've got yourself a major. Okay, so let's just having a bit of a sort of geography lesson around the shape and size, etc., of audits and different types of audits. Let's just pop into the fact that the commonalities between these are having your information ready. So those of you who are provisional and you have no clients, your job is a lot simpler because you can subtract the stuff from this talk today that talks about clients. Okay, so you have a much simpler job. But those of you who are first-time audit and you have clients, you've got a big job, and you want to be sure that you get it all right. There are some real pressure points which I'll just point out to you. So here's what you need to focus on. You need to focus on whichever area you're at, whichever audit you're going into, your clients and their documentation and the risk management assessment around those clients. That is imperative because that's where most people come undone. Also around the staff, their onboarding, their training, and their documentation meeting the standards. And the other areas that people usually fall down on are risk management and the risk system itself. So you could have different parts of the risk management system in place, but if you don't have a risk register, a corporate risk register, a business risk register, then your system has broken really big time. So people have bits and pieces of these things. And if you don't have the whole kit in the risk management standard, you will get non-conformities. So let's start at the beginning. I'm going to just go through I'm going to briefly go through an information collection list with you, and then we're going to go into what do you do with that information, because it's not just about collecting the information, it's about showing how you've organized that information, because in the showing of how you've organized the information is the demonstration that you have compliance and quality in place, okay? So we're not just looking, remember, if you've got background noise, please turn your microphone to mute. So I'm just going to share screen. Okay, someone's got background noise. Could you just turn off, and it's hard for me to know who because there's so many. If you could just turn your microphone to mute. I'm just enjoying my first coffee, would you believe, at 11:16.
Okay, well, I'm going to get Tally on for you.
Okay, I'm just going to try and mute everyone I can who's... Yep, it was Angela. There we go. All right, just going to let someone in. Okay, this is what I call my audit checklist. Okay, so this is really just a bit of what it is you need to collect. Okay, so let's just say you went all the way through this audit checklist and you collected all these documents. That's fabbo. It's good that you've collected them, but if you even try to give us all of those just in folders, we will just like fall over. It's so exhausting when people give us disorganized information. And do you know what the first thing it tells me about someone who gives me disorganized information is? They don't really know very much about quality. They just don't get it. So that's not where you want to start off. That's starting off on the wrong foot. Okay, so quality in itself and compliance, they're two different things. You know, it's really listening to a talk with Dr. Jeffrey Chan the other day in a conference, and you know, and I agree with what he said, and that is that regulations and compliance will not make good services. We need quality as well. Quality is a factor that is incredibly important. So we've got the carrot and we've got the stick. So the regulations and the law, that's the stick. But what we want is quality as well. Just passing regulations doesn't mean you're going to deliver a good service. In fact, quite the opposite. It doesn't mean that at all. So we really need to educate people in the word quality. I predate the NDIS by at least 25 years, and we didn't use the word compliance. Any other quality people out there, any people who've worked in quality, you'll know that. We didn't throw this word compliance around, but do you know what? The only way I can kind of motivate a large percentage of NDIS providers and aged care providers is I have to wave the stick, and the stick is the word compliance and regulation. And I find that really disturbing, that's what I have to wave around in media articles and things like that to really get the attention of people to do the right thing. The word should be quality. Quality and compliance actually go together. But I just find the word quality seems to fall on deaf ears. And that's incredibly sad. And that's why a lot of things are going off track in the NDIS, and there's a lot of problems and low quality service and continual non-conformities, complaints to whether it's the ACCC or the NDIS or to advocates. If you could just get yourself a grip on quality, you'd be delivering better services and you'd be a much better operator. And I'll tell you something else which might sway you, is my career took off. And I think my asking salary went up by, well, you know, in the 2000s, in the year 2004 or 5, I was earning $160,000 a year because I was working in quality. Because, well, I was a CEO, but I was using quality frameworks to do my job because my services were so sought after because of my quality knowledge. Because I want you to think about quality as not just quality, it's governance. And you don't run a business well without governance. Quality is governance and risk and compliance and excellence in service delivery and forever seeking that excellence in service delivery. And if you can do that, you'll not only be the most sought after employee in many areas, your business will do extremely well. There's no point in making $1 million profit when you come out of your audit with 35 non-conformities, because it's only a matter of time before somebody gets hurt. So information, we're going to collect information first. So you can't start organizing your information till you've collected at least some of it. All right. So let's just separate your stage 1 from your stage 2. Stage 1 is all about documentation. So stage 1 can be done remotely by computer. Stage 1 is looking at your policies and procedures. Okay. First of all, we've got to check what it is you say you're going to do, and is what you're giving us aligning to the standards, the quality and safety standards. Okay. So you might come out of stage 1 with a few non-conformities, and that's okay, because that's just stage 1, because sometimes we're able to close off those non-conformities just by going into stage 2, because you show us something that we weren't able to see, or you tell us something. Other times your policies are just not compliant, and that non-conformity will stick. Yeah. So that's our stage 1. Stage 1, we're looking at your documents. There's little point in giving people all of your files and templates and things like that, because we're not going to look at that in stage 1 very often. We're going to look at your policies and procedures, your business plan, all the fundamentals. We're going to look at all those foundational fundamental things. And it's all about us reading and checking things off. We don't really need to talk to you in that stage. Some auditors will do a stage 1 and stage 2 together. And that's usually when you're provisional, you've got no clients. If anyone tries to do that to you when you've got clients, tell them, no, I want my stage 1 and my stage 2 separate. Thank you very much, because they're not giving you time to fix some of your non-conformities from stage 1. And that's not right. Okay, so it is better to have a stage 1 and then a week or 2 weeks later have a stage 2. And that's just the right of a provider to ask for that. It is the convenience of the auditor to sometimes do a stage 1 and stage 2 together. And it's not often fair on the provider. So we're going to collect for each and every person that is a part of, am I sharing? Everyone seeing what I'm sharing? I think I'm on share. Yep, hang on, let me just check. I've done it before. Yeah, see, thank you. I'll just share. There we go. Now, someone just give me a thumbs up to make sure I am sharing. Yeah, good. Thanks, Barbara. Okay, I've done it before. I've gone like 15 minutes without sharing the screen. So what we've got here, stage 1, key staff, people's files, all right? So first of all, you're going to need 100 points for every single person that works in your organization, whether they're an ABN contractor or not, okay? Even consultant contracts that you have with people, you don't often need 100%, 100 for that, because they could be a company. But anyone who individually is doing work for you, and ABN contractor support worker, ABN allied health professional, you do need to have 100 points of ID for that person and all of the relevant working checks, okay, for that person. So you go about collecting all of that. So if you give us, some people have given us that when it's just all in a folder, please don't. You know what, I just send it back. Just put it in a person's folder. Make sure that you have organized the data properly. Let me just check what's in the chat here. I've got, yep. Make sure you've organized the data properly. I'll tell you what happens. There's an information standard, and it asks about, all sorts of things about how you've organized the data, what your skill is with that, and if we get really annoyed, like we can take a little bit of extra work, but if we get really annoyed with the way you've thrown data at us, we can just give you really poor ratings in the data standard in governance, and kind of you deserve it. So you really need to organize your data properly. Please try to remember not to leave old documents in with new documents. I suggest, you can do it any way you like, but I suggest that every folder, every main folder have an archive folder, not one big archive folder in the whole system, one in each of these areas, so that when a particular client's forms or assessments or plans are outdated, you can pop them into an archive folder, because when people throw us all that information and think we've got nothing better to do than go through 5 different plans to find the right one, it's really annoying. And and there is an information standard, and that information standard gives us the opportunity to say, you know what, this wasn't up to standard. So think about how you're organizing your data. Make sure that you're not having really old things. And one thing is, and any colleague would agree with me, don't throw things at us in the hope that we'll find what we're looking for. Be very particular that you're giving us what we're looking for, okay? So there's your tips and your qualifications, etc. So organize everyone's data in a very orderly manner for us to be able to see it. And this is just, remember, this is just information collection at the moment. Anyone who needs a professional body you must have their relevant information about that. Every person who faces who is in front of a client at any point in time must have first aid. And that means that if you've got an admin person and they do come into contact with people, then they need to have that as well. It could be argued that if you are only remote and you've never and ever going to see a client, like you just work telehealth or a remote support coordinator, then you wouldn't need that. But you wouldn't need the first aid. But the fact is, if there's any chance that you're ever going to be in the same room with a client, then you must have it. So all of your screenings, etc. And then we come down to the nitty-gritty stuff, which is around the NDIS induction module. And everybody knows that these days they have to have the worker module. Contracts, employment contracts or contractor agreements, any records of professional development. If you're going into your audit not provisionally, then there should be professional development records, the training that you've given, the supervision that you've given, all of that stuff needs to be available within that person's folder or somewhere. The insurances associated with not only your own business, the vehicles of the people who are working for you, and also the insurances associated with any ABN contractors as well. So cars, business insurance, etc. And remember that any ABN contractors, of course, must have their own public professional indemnity and public liability and personal injury insurance. And then to top it all off, please try to make it easy on yourself and have something like a signed induction checklist that says all of the things that you're needed and grabs the signature of the staff member and the date, because that goes a long way for us. That gives us evidence that this stuff has been collected in an orderly manner and that you've taken notice of that. So that really helps towards a good rating. And it shows us not just compliance, but some quality. So compliance is what you must do. Quality is what you do to ensure that the service is going to be a good one, yeah? And that you're going to be in a position to maintain the best possible service. Remembering these days too, that if you've got clients and you're working with them at a time when they would be eating food, this is, you know what, I would say this is where 90% of people get non-conformities. If you've got we're not going to put it into like SIL or this category or that category. If you are working with a person at a time that they are going to be eating in front of you and that person has some kind of requirement for mealtime, then you need to have that mealtime management plan. So some people will say, can I get you, whoever just came in the room, please, to put yourself on mute? So please be going through your client lists and see who, it's not just about swallowing difficulties. I remember, I want you to be familiar too with the mealtime management policy, which outlines lots of different things that you need a mealtime management plan for. It might be a swallowing difficulty. Sure, that's the most obvious, but it could be that they overeat or undereat, or that they have an allergic response, or that they have an intolerance, that they have bulimia, they have anorexia, they have anything that affects what goes into their mouth is something that might require a mealtime management plan. And a mealtime management plan needs to be written by a qualified allied health professional, not so with a nutrition plan or a my eating and drinking profile, we used to call it before the NDIS. From my perspective, good practice when you're providing supported independent living, STA or MTA, or you're overnight with somebody a few nights a week, that person should have a my eating and drinking profile, because that uncovers any of those things. It doesn't mean they've got a mealtime management plan. It means that you know what they like to eat. You've got all these things in front of you. You're not just winging it every time a staff member goes in to know what their foods are. We want to do things in an orderly manner and in a repeatable and duplicatable manner. And it was just normal practice that in residential care within the New South Wales Disability Services, that a my eating and drinking profile was done for everybody. And if you were doing community participation with that person and you were with them at lunchtimes and dinner times, also just knowing what it is that their diet requires and what their preferences are as well is really important. Yes, you'll get a copy of this. You'll get a copy of the checklist. Absolutely. That was Tanya asking. And then you're going to need evidence of all the trainings they need. Now, this is another common mistake that people make. They'll come in with a worker orientation module, but they didn't read the core module. Well, they haven't read the standards, or maybe their policies don't actually even outline what training staff need. There are specific things in that core module and other modules that really tell you what training is the baseline for your staff. If your policy doesn't say it in black and white, it should, because it's just easier for you to know what those trainings are, okay? And it's different, it changes when you add on modules, of course, more training is needed. That is just the baseline. I want to go over and above the baseline. I mean, I don't want a mediocre service. I never did. I wanted to make sure my staff knew as much as possible so that we had the best outcomes for our clients. And yeah, simple as that. But there is a baseline and you need to be aware of that. Waste management is one of those things. Emergency and disaster is one of those things. Not so much mealtime management, but safe and enjoyable meals is a baseline for anyone who has the mealtime management practice standard in their package. So these are the things around your staff, really important. So remember I said the two main pain points, staff documentation and the way they've been onboarded, and client as well. So they're people's biggest issues, and obviously the most important things. Can provide and make my eating and drinking profile? Oh yeah, absolutely. The my eating and drinking profile is an internal document, and a mealtime management plan. Whenever we think of mealtime management plan, think of that as the one that's written by the professional. So that is really the one that is paid for out of the plan. And a my eating and drinking profile is, I would call it sensible, considerate, required, that you know that stuff about somebody. So I think if you're looking for best practice, my eating and drinking profile is a really good idea. So there's nothing in the standards that says you have to do a my eating and drinking profile. But my question to you is, why wouldn't you? Like, why wouldn't you? So that's our people, all right? And our people, I'm going outside of audit stuff here, but I can't help myself. People can be your biggest asset or they can be your biggest liability. And you decide by your actions and the amount of time and effort that you put into them, which one of those they're going to be, okay? And I've always gone for the idea of being my biggest asset. I put a lot of time into the people that I believe are going to be right for the organisation. Okay, we come down to key business documents. Number 2, professional indemnity insurance. Well, that's for your organization and for any contractors. Public liability, same deal, your organization and any of your contractors. Once again, I just hit on the ABN staff. Please don't forget about them. And most people don't. Most people are really aware of that these days. A few years ago, people were not on top of it, but people are now. For your vehicles, same again, car registration, insurance details. Now remember, we're only talking about collection of information here, not about what you're going to do with it. So your workers' comp goes without saying. Copies of all those documents, have them organized. Do you know, sometimes we do audits and someone goes away and takes 10 minutes to find it. And I'm just gobsmacked that can happen. Like, have them ready. It's an audit. Your policy documents comes under business documents. So your policies and procedures, etc. So you're collecting all this information, and that's a really good start. Then you've got your governance documentation. It says very specifically that you will have an organizational chart. Nobody really cares whether you put it in your governance operations policy, whether you put it in your business plan, or where you put it. It doesn't really matter where you put it. That's up to you. But you must have an up-to-date and current organization plan. And yes, sometimes we find people giving us organization charts that are like 2 years out of date. And they give us position descriptions which don't match those organization charts. So think about it. Organization chart must reflect the current organization situation. And anything that you put on that organizational chart, we are going to ask for a position description that matches. Okay? Doesn't matter if you've got one person doing 3 jobs. If they've got 3 jobs, it needs to be either all in the one position description, or a position description of some type is reflecting all of those 3 jobs. Okay. Then you're going to need something called your staff matrix, I suppose, which is where you're going to put all of this information. We want to see not just that you've collected it, we want to see how you're managing the due dates for renewal on a number of different things. Okay, so that's the stage 2 area. Stage 1 is collecting this. Stage 2 is showing us how you organize that information and how confident can you make us that we think you're going to check for the renewal dates on all of these things. And that's what we call the system. So if you can't show us that, you're only going to get half marks. You're going to get probably a major nonconformity, but maybe maybe at some points a minor. So we need to see how you manage all this documentation. Business plan, I think most people are fairly aware that the business plan needs to be there. There are certain things inside your business plan which are non-negotiable, and you will find them written in the standard operations and governance in Division 2 of the core. I'm going to sneeze in a minute. So your business plan needs to cover off on those particular things. So please refer to your standard for that. It'll be about legislative, environment, staffing, etc., etc. I think that's probably another most common area where people fall down. They have a business plan, but they just forget to go into that standard and see what it's actually asking on top of the other things you're putting there. The other thing I would say about the business plan or strategic plan is if you're going to a subsequent audit, please report on the first business plan. Some auditors just don't have the expertise to know that they're supposed to be looking for your report, a one-pager, whatever it is, on how you went against that last business plan's goals, okay? But there's also a large majority of auditors who do know and do understand that and do ask for it. So we need to see, and the standards say, you've reported on your progress against that business plan, okay? So job descriptions goes without saying, and I've said if you put any position anywhere in your paperwork, know that we are going to ask for a job description. And some of us will read it so carefully that we will be able to pick up on whether it's something that you downloaded from Seek or whether it really is legitimately for the job that you have, because I actually see that as being one of the biggest precursors to incidents in the workplace when people are given no job description or very silly job descriptions. So when I talked about asset or liability, this is one of the things that will determine whether you're going to have staff be your asset or your liability. More governance documentation. Of course, you need to go in there with your business continuity plan. What what you're going to do in the event of an emergency or disaster or disruption to service. You're still going to need your COVID action plan. It's just is as it is. Your corporate risk register. You do not go into an audit without a corporate or business risk register, because it's actually the glue that holds quality and compliance together. If there were one thing about your entire process of getting ready for audit, or one element of quality and compliance or business excellence or safety and quality or any of that, it's the corporate risk register. It's the foundation. It's the center of the universe. It really is. Without that, you'll never get through a clean audit. So we've talked about that. So you will get this. And now what we're going to do is we're going to move over to how we can organize some of that information. So some of you might have a software, some of you mightn't, but I haven't seen a software yet that is able to collect any more than 75% of the information that needs to be organized to show us that you know what you're doing, and that you can be reminded of things. Would you excuse me while I just blow my nose? So I've not yet seen one that collects any more than that. So the overflow from, and I think that software was CareMaster, and I think it collected about 60 to 70% of this information, but there was still an overflow. So at some point you still need to have some mechanism to collect this information. So this is my custom made tool. You can see here, what I outline here is in the orange is all the things you need going into a provisional audit. That means you've got no clients. You're not delivering service yet. But that's not the case for people who are going into an audit with clients. Generally speaking, you would need to complete most of these. So most importantly is, if you don't have copies of staff meetings and minutes, then you're going to need to record some way. You need to record that you are recording your decisions and the reason why you made those decisions and whether they represented a risk. Okay, so if you don't have meeting minutes, do something like this, because you will get a non-conformity if you're delivering services and you've got no meeting minutes. Okay, because governance the key to governance is minutes, meeting, and recording those. The next thing is your corporate risk register. There's, there are some videos on my website, on my YouTube and on my training management system, which go into this. That's an hour and a half in itself, just going through that. You must have a corporate risk register. You need to have a policy review schedule. You will get a non-conformity if you can't show that you have a policy review schedule, because that's part of the quality practice. You need to record your regulatory compliances. So all those documents that we collected, remember I said we need to know when they're all due. I know some of you will have software that does that, and then some of you, the software will not go as far as to collect everything. But we need something that is going to help you to remember and put all of that information into some kind of orderly fashion, basically. Okay, so we've got a couple of different types of regulatory compliance requirements. We've got insurances, which I just clicked on, and then we've got the vehicles. So you can end up having a lot of vehicles if you've got staff. Remember, they don't have to be your vehicles, it's their vehicles. If they're driving a vehicle with a client in that vehicle for the purpose of your work, you become responsible. So example is, if somebody's rego is 2 days overdue because they forgot to pay it, and they have an accident, you're responsible, because the reason is you said when you became an NDIS provider that you will make sure that every one of their credentials is valid, current, and up to date, including insurances. So as much as their insurance won't pay for them because they're overdue their rego, you will be responsible. So this is your agreement when you become an NDIS provider or any other provider. And what it was in the days before NDIS was anyone receiving government funds for programs. We agreed that we would make sure these people all had their registrations and their insurances. Your disaster and emergency drills, you need to have an example that you can show that you have got either you've got some drills that you've done, or you're planning to have them, and how you're going to, and what people are responsible. Then you've got your, that's not a necessity, your asset list. There's nothing in there that asks about asset lists, but it just seems pretty poor governance to not have an asset list, from my perspective. Conflict of interest, absolutely, totally. The conflict of interest between participants and your place of work, or participants and staff, or staff and staff, or family and staff, etc. Conflict of interest is usually another pain point during audits. Incidents. Please make sure that every incident that is mentioned in anyone's file has an incident report piece of paper, and that piece of paper has also been aggregated here in your incident register. It's never been negotiable whether someone should have an incident register, never. So you'll never get out of that one. Internal audit tool, it doesn't really say you have to have that, but we just put one in so that people can sort of schedule different areas of their the audit, because I think you all know that in between your commission audits, it is expected that you will have performed an internal audit and that you'll be able to demonstrate that. Yep. A lot of people outsource their audits, their internal audits, because a lot of the time people don't really know how to do internal audits. And if you don't know what you don't know, then you're not likely to pick up everything. So they outsource it to companies like mine and the others on the market. Internal audit schedule. Root cause analysis. For every reportable incident that occurs, it is required of a provider that you do a root cause analysis to ask yourself why it happened and what was the cause and what will you do to ensure it doesn't happen again. Work health safety. Some auditor that audited my stuff 5 years ago said you need to have a work health safety register. I'll put it in there, but you know what? Like, you can just put it in the incident one, because we just have a category in the incident register that says work health safety category. But some auditors are just a bit odd, so it's kind of stayed there. Complaint management register, absolutely. Complaints and incidents, two other pain points, I think. Remember, if there are complaints made or feedback made, please have that documented somewhere, whether it's in a progress note, but complaints also need to go to, some kind of complaint form that has a process of its own, and it needs to be that, you won't get away with not having a register for complaints either. And often we do find complaints that people have not listed there, and yeah, that does happen frequently. So you will get non-conformities for that. The next important thing, your quality improvement plan. If you are delivering services, meaning you're not provisional, you will be expected to demonstrate continuous quality improvement. Can anyone tell me off the top of their head what they know to be like maybe the 3 main categories that should feed your continuous quality improvement plan? Who wants to take a guess? I'll just answer these questions while you're thinking. Can provider make, yep, I've answered that. Can provider is corporate risk register separate to general risk? General risk is just a very broad term. So in our NDIS or aged care, you've got business risk, which is corporate risk, and you've got participant risk. So when you say general risk, if you mean all the things that can affect the organization as a whole, then yeah, they're the same. But you also need to have a participant risk one as well. I don't put individual risk in with corporate or business risk. And I'm not sure where general fits into that. That word possibly doesn't fit in this context. So we kind of say corporate or business or individual or participant. I only have 2 clients. All of this is required. No staff, just 2 contractors. Well, you've still got 2 contractors and you'd expect to see everything that I've said just for those 2, even if you had 1. And for your clients, we'd expect to see the same level of, good quality assessment, risk assessment, and the appropriate training for the contractors who are working with those clients that actually relates person-centeredly back to the clients. So we'd expect to see the same level of quality for just 2 clients or just 2 contractors as we would see. Obviously, you don't have the volume. It's not like you've got 20 staff and 20 clients. You won't have the volume, but we expect to see the same quality. So there's nothing I've said here that doesn't apply to you with 2 clients and 2 contractors. So coming back to that, did anyone have an answer of, I always call this the C of continuous quality improvement. And as you'd know from geography, there are certain rivers and lakes and estuaries perhaps that flow into a sea. So let's see what people have said. Feedback and complaints, yes. Audit results, yes. Reviewing care plans such as improvement measures against standards, yes. Yes. So if you have complaints and incidents and risks and other issues that have occurred, and we can't see that you've put something in your continuous quality improvement plan, how you've dealt with them, you will get a non-conformity because complaint standard says that there is a demonstrated continuous quality improvement around complaints. And it says in incidents that there is a demonstrated quality improvement process around incidents. So 2, right off the top, if you can't show, you will get non-conformities. But I'd like you to just consider everything a lake that can flow into this. Do you know what I mean? Improvements to services, correct. Even if nothing even, let's just say nothing even, there wasn't a complaint or an incident or an accident or anything like that that triggered a particular improvement. What if you just make one, then put it in here? And, one of the things I used to use when I would go, from one job to another as a CEO or as a GM or as a quality something or other would be my record of quality improvements. It's really important to have. And yeah, this is what quality services do. Further training, yep, when there are issues with the training, absolutely spot on, guys. So let's see a really healthy one of these, because without this, you can't possibly have a quality informed service. Yep. Where was I? Back to, we're nearly there. We were at quality improvement, were we not? Yep, we were. Feedback, well, that goes without saying, that belongs with complaints also. Show us a record that any environments that you are working in, and that includes cars, show us a record that they're getting deep cleaned or sanitized. Yep. Make sure that you have meeting minutes. Now, if you only have 1 level in your business, fine, there'll be 1 level of meeting minutes. If you have support worker meetings, and then you have management meetings, and then you have executive management meetings, then we would expect to see 3 levels of minutes. And what we would expect to see, please remember, we will look at your agenda items, because this is the key to governance, as well as the corporate risk register. But meeting minutes is the key to governance, because it's the information flow. And if the information flow is not is not working, if it's blocked, if there's one particular item of agenda item on your frontline meeting minutes agenda, and we don't see that flow all the way up in any way, shape, or form, then we know it's not working. So your standard agenda items are one way of proving and ensuring, by ensuring you collect information and talk about certain topics, which lends itself to better governance. It is so easy to see, once you've done this for a long time, where the problems are and why. You hear something and then you can just guess that they don't have standard agenda items. Sometimes we see people with really full agendas, but none of them are standard items and none of them deal with the most important governance areas here. So you can't possibly have good governance and therefore quality services if you're not talking about these things. These things need to be done in a standard fashion. So there are no time to go into what all those standard agenda items should be, but suffice to say, they are surrounded around governance. If you're SDA, you'll need a maintenance schedule. If you're SIL, we'd still want to see that you're doing maintenance inspections. If you want to really easily demonstrate that you know who's who and who needs your help the most, if there's a disaster or emergency, a client prioritization matrix is a good way to do that. This is the participant risk register. This is what I spoke to you about and said, here is the different type of risk. There's the corporate risk, and then there's the participant risk register. And this is what we would want to see if you don't have a software system that's able to remind you when somebody's risk assessment is due to be renewed. This is basically a way of organizing and structuring your information so that you can track who is due, when they're due, and mark them off as being done. If your software does that, good. If your software doesn't, then you need something to show us that you've got your eye on the ball. Delegations register, you don't need a register, you can have a policy, but whatever you have has to outline whose job is what, okay? So that someone can quickly look at something and go, you know what, the CEO does all this, and if the CEO is sick or gets hit by a bus, this person, your plan B, is going to be able to take over some of those things. We don't care whether it's in a policy or in a register or in a table or whatever it is. It doesn't matter how you do it, as long as the jobs and the categories of jobs that are in your organization are outlined somewhere, and who can do what and who can't do other things. Yep. So that's just always been the easiest way to do that for me. We've got down here, if you've got a way of being reminded that support plans are due, great. If you don't, there needs to be a way. You need to demonstrate to us that we know you've got your eye on the ball and you are reminded in some way, shape, or form that a support plan is due for renewal, okay? Otherwise, we've got no confidence that it's going to get done, okay? Everyone has to have a person-centered emergency preparedness plan, and also that needs to be redone annually, or if something, in between happens. So what reminds you to do that? This is about the system where we've collected all the information, but what are our systems to manage that information? Participant onboarding checklist. It's not something that you have to have, but some people like to list all the participants who have been onboarded, and it's just one way to do it. We have a complex care register because there are far too many clients and far too many organizations who are not recognizing the complexity of the people that they have, which is why we are in so much trouble. So, if it's diabetes, we want to know that you're reviewing these on a regular basis. If it's mealtime plans, when are they due to be reviewed? If it's a mental health plan, when is that due? If it's, et cetera, and ad infinitum, yeah? So there are so many other plans within the care of a person which are not always kept up to date. And just to have the information structured, that's all. If you've got a software that does it, great. Medications should be reviewed. So we have a medication review schedule to remind you that you can use pharmacists or send them to their GP to just review their medications, just to see, you know, how many are clashing with the others. Yeah. It sounds ludicrous that we should have to do that, but you know, back in 2008 in the Macquarie Mental Health Hospital in North Ryde, there was such a mess with the long-term clients there, and there's a couple of hundred of them, that they had to do something. It's a schedule something under the Mental Health Act, where they had to send in, I don't know, I think it was about 10 psychiatrists from across New South Wales to do medication reviews on every single patient over that week. And they found the amount of medications that were prescribed and had just not been reviewed were at dangerous levels. And we need to be really aware that doctors don't always look. And sometimes there are different doctors and they're not looking at what already was prescribed. So having a medication review is best practice, okay? Oral health review. If you are looking after someone 24/7, you might need to remind them, number one, when their dental appointments are, or make them for them. And number two, also be helping them with their oral health day to day, especially people with intellectual disability, ASD, older people, dementia. The comprehensive health assessment plan, which came into action, you know, back in 2021 in December, you just got to have something that reminds you to renew it. You know, it needs to be reviewed. We don't want to find one that's 5 years old. We want those to be done, you know, annually or biannually. You know, we need people's health in SIL services to be managed and respected. Your restrictive practice register goes without saying what that is. Sometimes people have medical reports and all of these get all mixed up and etc. So we do provide a medical report register. This is really going into really good practice there. Mental wellbeing anniversary. If you're dealing a lot with people with mental illness, it's a really good idea, just from my mental health background, to mark down what their anniversaries are for deaths or attempted suicides or you know, all sorts of family anniversaries, the death of their mother, etc. Because we often find that this is when people act out and become quite unstable. Also, when people are going for court appearances, because I worked in drug and alcohol for a very long time, we would find the house would go, you know, completely topsy-turvy, or one person would be out of sorts incredibly when they had a court appearance coming up, or you know, sorts of things like that. So recording that sort of stuff can really help you manage people's mental health and their well-being. I think participant assets and induction. Yes, we want to see, when you've got a SIL client, we want to see where you've recorded what belongs to them and that they have been inducted into the house. So that is actually stated in the standards. And record and the place for recording all your stuff, and we'll kind of finish it because we don't want to go too over time. This is, if you haven't got a software to do this, and I know some people don't, then you need to be able to record all of those things that you collected that have time delicacies, you know, that have due dates, that have renewal dates, etc. You need to be able to collect them somewhere and be able to come back to them and view them on a regular basis, you know, whether it's lighting up telling you it's due, or whether it's gone way overdue and you're in breach of the standards. So those things are incredibly important. HR matrix, then your risk assess roles. Don't go in there without outlining your risk assess roles. You will get pulled up for it. Don't go out in there without having a list of who you've got a worker screening for. Performance appraisals, we want them done annually, whether they're ABN contractors or whether they are employees. Supervision, we want to see that you've been providing supervision to your staff. So we want evidence of performance appraisals and supervision. We want evidence of which are your risk assessed roles and why they're risk assessed. We want to see how you manage the information you collect and what needs, and the renewal obligations in relating to your staff. So I've crammed that last bit in. Let me just read some questions to you. If we want to update the register, so where to keep the previous record, for example, exited participant and staff, yeah, you can update them if that's what you're asking. If they're leaving, you can just write that they've exited. Don't remove them. You can hide the line, but don't ever delete the actual entry. Do we have to have a chat for respite clients as well? If you're having the respite client on a regular basis, maybe, but I can't really see the point. I think it's arguable, you know. I can't really see the point because you're not really, they're not, yeah. I don't think so. Not unless you're having them for long periods of time, like MTA, medium-term accommodation or something. Probably not. Are there any other questions, guys? Oh, I'm in a bad way today. No other questions from anyone? Pleasure. If you haven't already found my YouTube channel, if you just Google effective policy, there's a few bits and pieces up there. And if you're looking for any training and learning for your staff to get ready, we also have a learning management system. Where do you find the NDIS standards? Where do you find the NDIS standards? If you were to just go to the NDIS's Commission's website, I think it's easier to go to Google, quite frankly, but you would find them there. So I would suggest Googling it and it'll take you right to the place. And if you went straight to the Commission's website, you probably want to poke a stick in your eye trying to find something. So if we're starting to give respite every week, 1 day a week, no, I still don't think it's your responsibility. I think it's really good to have a thorough risk assessment, though, in that situation. Thanks, Tegan. Do we need to get the insurances for the plumber and electricians? Well, if they're coming on a regular basis, not if it's just the occasional fix. That's for you, Ritu. Any other questions? Hi, Manpreet. Hope you're well. Yes, no, that's fine. You know what? It's good due diligence to make sure that they've got insurance, though, because, but you know, we do expect them to have it, but sometimes they're buggers, aren't they? Thanks, Barbara. Thank you. Yeah, I thought I just had allergies, but I think I'm probably getting a cold. Ah, dear. What can you do? Do you see unregistered providers being fair? Absolutely. That's absolute. So anyone who's, yeah, absolutely. And we are all pushing for that. So yeah, there will be grades of registration, but there won't be anyone allowed to deliver services without at least having some form of registration. And it should be in direct proportion to the complexity of the service that they're delivering. Test your staff and ask them how many NDIS practice they have. Yeah, you can do that. I like to test them. I actually like to ask them on a regular basis, what's a reportable incident, and tell me what all the categories of reportable incident are, because it concerns me when they don't know. For re-registration, it's big, so it'll be the whole thing all over again, and it's a really big deal. So they'll start from scratch like your first one, but you've got all the clients. So they're going to go painstakingly through every module that you're registered under. So really focus on your staff and client documentation and your risk and your assessment, and the system that guides you in keeping it up to date. It's all about systems. Remember too, can I just remind you, if you're going back for a subsequent audit, please go back to your last audit and make sure that you haven't left any minor non-conformities open, because you'll get an instant major for going to an audit with an unclosed minor. Actually, they also can suspend you if they want to, but I don't see that happening very often. But they have the right to. Okie dokie. Well, it seems like the questions have trickled off. If you have anything, we're able to copy the document. You'll be getting a copy of the recording. You'll get that checklist, and if you want to purchase the Excel spreadsheet, I'll put a link in there for you to do that with a discount code. And there's also a video that outlines how to do that, about an hour and a half video. No worries. It's lovely to have a few people that I've never met before. My pleasure. I love it. Thanks, Ritu. All right. Any other questions that you didn't get to ask, please just email me or go to my YouTube channel. Thanks, guys. Have a good day. Thanks, Louise. Thanks, Jessica. Thanks, Carmen. Thanks, Albert. Thanks, Kim. Thanks, Ritu. Thanks, Stephanie.